What if the answer to your chronic back pain, that deep, aching, exhausting pain that has been stealing your sleep, your mobility, and your quality of life, is not another painkiller, not another injection, not another expensive therapy session, but one simple collagen capsule that you swallow every single morning with your breakfast? Because right now, groundbreaking research on spinal disc regeneration, vertebral cartilage repair, and spinal ligament strengthening is pointing to one extraordinary conclusion: collagen supplementation in capsule form is giving people over 60 something that no prescription medication has ever been able to offer. Not just temporary pain relief, actual structural repair of the damaged spinal tissues that are causing the pain in the first place. And today, I am going to show you exactly how it works, exactly which capsule to take, and exactly why thousands of Americans over 60 are waking up with less back pain after adding this one simple thing to their morning routine. And real quick, before we dive in, if you have a parent, a spouse, a friend, or anyone over 60 in your life who has been struggling with chronic back pain that nothing seems to fix, pause this video right now and send it to them. Because what we are about to share could be the missing piece they have been searching for. And if you are not subscribed yet, hit that subscribe button right now, because every single week we bring you honest, research-backed, and genuinely life-changing health information for people over 60 who deserve real answers. Now let us get into this completely, because your back has been waiting for this information for a long time. Let us start by understanding something that most people over 60 have never been told about what is actually happening inside their back, and why collagen is so uniquely and powerfully positioned to address it. Your back is held together, cushioned, and supported by an extraordinary network of connective tissues: spinal discs that absorb shock between your vertebrae, cartilage that lines your facet joints and allows them to move smoothly, ligaments that connect your vertebrae and provide stability, tendons that attach your back muscles to the bony structures of your spine, and the annulus fibrosus, the tough outer ring of each spinal disc that contains the gel-like nucleus inside. Every single one of these tissues, every single one, is made primarily of collagen. In fact, your spinal discs are composed of approximately 90% collagen by dry weight. Your spinal ligaments are approximately 75% collagen. Your facet joint cartilage is approximately 60% collagen. Collagen is not just important for your back, it is the fundamental building material that your entire back is constructed from. Now here is what changes everything after the age of 60. Your body's natural collagen production, which was already declining at a rate of about 1% per year starting in your mid-20s, has now fallen to levels that are genuinely insufficient to maintain the structural integrity of these critical spinal tissues. By the time you reach 60, your body is producing roughly 35 to 40% less collagen than it was in your prime, and the consequences of this collagen deficit in your back are profound and progressive. Your spinal discs begin to lose hydration and height, a process called disc desiccation, because the collagen matrix that holds moisture within the disc has deteriorated. As the discs lose height, the spaces between your vertebrae narrow, increasing pressure on the surrounding nerves and joints. Your spinal ligaments, now collagen depleted, become lax and less able to provide the stability and support your spine needs, leading to increased mechanical stress on every structure in your back with every movement you make. Your facet joint cartilage thins and roughens as its collagen matrix breaks down, causing the grinding, aching, morning stiffness that so many people over 60 experience as an unwelcome daily companion. This is the fundamental biological reality of back pain after 60, and it is a reality that anti-inflammatory medications, muscle relaxants, cortisone injections, and even physical therapy cannot address at the root level. Because all of these treatments work on the symptoms of collagen-depleted spinal tissues, the pain, the inflammation, the muscle guarding, without ever providing the raw structural material those tissues need to actually repair and rebuild themselves. Collagen capsules do something fundamentally different. They provide your body with the precise amino acid building blocks, primarily glycine, proline, and hydroxyproline, that your collagen-producing cells need to synthesize new collagen and deposit it in the exact spinal tissues where the structural deficit is greatest. This is not symptom management, this is tissue nutrition. And for anyone over 60 whose back pain is driven by collagen-depleted spinal structures, which is the case for the vast majority of people in this age group, it represents a genuinely transformative approach. Now let us talk about the science. because the research on collagen supplementation for back and spinal health is more compelling and more extensive than most people realize. A landmark clinical study published in the journal Nutrients examined the effects of specific collagen peptide supplementation on patients with chronic back pain over a 12-week period. The study found that participants who took collagen peptides daily experienced significant reductions in back pain intensity, significant improvements in back mobility and function, and measurable improvements in quality of life compared to the placebo group. The researchers attributed these improvements to the regenerative effects of collagen peptides on the connective tissues of the spine, specifically noting improvements in disc hydration and ligament integrity on imaging studies in the treatment group. Another important study published in the Journal of Agricultural and Food Chemistry demonstrated that specific collagen peptides, particularly type 2 collagen and type 1 collagen taken together, are selectively absorbed and deposited in joint and connective tissues rather than being broken down and used as general protein. This selective deposition mechanism is what makes collagen supplementation so uniquely effective for targeted tissue repair. It is not just protein, it is targeted structural medicine that finds its way to the exact tissues that need it most. A further study published in Current Medical Research and Opinion found that patients with degenerative disc disease who supplemented with hydrolyzed collagen experienced significant improvements in back pain and disability scores after just 8 weeks of consistent daily supplementation, improvements that were maintained and continued to develop over the following months of the study. Perhaps most exciting of all is a growing body of research on what scientists call collagen-induced chondrogenesis, the ability of specific collagen peptides to actually stimulate your body's own collagen-producing cells to increase their synthesis of new collagen. This means that daily collagen capsule supplementation does not just provide structural building blocks from the outside, it actually switches on your body's internal collagen production machinery, creating a powerful compounding effect where external collagen supplementation and enhanced internal collagen synthesis work together simultaneously to rebuild and restore your collagen-depleted spinal tissues over time. Now let us talk about which type of collagen capsule actually works for back pain, because this is where most people go wrong and end up spending money on products that produce minimal results. Not all collagen supplements are the same, and the type of collagen matters enormously for back-specific benefits. There are at least 28 different types of collagen in the human body, but for back pain relief after 60, the research points most strongly to 2 specific types that work best in combination. Type 1 collagen is the most abundant collagen in your body and is the primary structural collagen in your spinal ligaments, tendons, and the outer annulus fibrosus of your spinal discs. Type 1 collagen supplementation directly supports the repair and strengthening of these critical structural elements, reducing the ligament laxity and disc wall weakness that contribute significantly to back pain and instability in older adults. Type 2 collagen is the primary collagen of cartilage, including the cartilage of your facet joints, and research has shown that undenatured type 2 collagen has a unique mechanism of action involving oral tolerance that makes it particularly powerful for reducing joint inflammation and promoting cartilage regeneration. When types 1 and 2 collagen are taken together in capsule form, they address both the structural ligament and disc components and the cartilage and joint components of back pain simultaneously, creating a comprehensive spinal repair effect that neither type alone can fully achieve. When choosing a collagen capsule for back pain, look for products that contain both type 1 and type 2 collagen, that use hydrolyzed collagen peptides for maximum bioavailability, that are sourced from grass-fed bovine for type 1 and from chicken sternum cartilage for type 2, which are the most clinically studied sources, and that are third-party tested for purity and potency. Avoid collagen products that use only marine collagen for back pain. Marine collagen is predominantly type 1, and while excellent for skin and nail health, it lacks the type 2 component that is critical for facet, joint, and cartilage repair in the back. The recommended daily dose for back pain benefits based on the current clinical literature is between 5,000 and 10,000 milligrams, or 5 to 10 grams, of hydrolyzed collagen peptides per day. Check the label of any collagen capsule product carefully. Many products provide only 1,000 to 2,000 milligrams per serving, meaning you may need to take multiple capsules to reach the therapeutic dose range that clinical studies have used. Always take your collagen capsules on an empty stomach first thing in the morning. This maximizes absorption because collagen peptides compete with other dietary proteins for absorption pathways, and taking them before eating ensures they are absorbed efficiently and transported directly to your target tissues. One more critical point about collagen capsules and back pain: vitamin C is absolutely non-negotiable as a companion supplement. Your body cannot synthesize collagen without vitamin C. Vitamin C is the essential enzymatic cofactor that converts the amino acid proline into hydroxyproline, the modified amino acid that gives collagen its unique triple helix structure and mechanical strength. Without adequate vitamin C, the collagen peptides you are taking in your capsules cannot be properly incorporated into new collagen fibers in your spinal tissues. Take 500 to 1,000 milligrams of buffered vitamin C, sodium ascorbate, or calcium ascorbate at the same time as your collagen capsules every morning. This combination ensures that every collagen peptide your body absorbs has the vitamin C it needs to be immediately and efficiently converted into structural collagen in your back. Now, I want to stop right here and share a story with you, because the science and the research become so much more meaningful and real when you see what they look like in someone's actual daily life. Ramon is a 66-year-old retired firefighter from San Antonio, Texas. 32 years of firefighting, carrying heavy equipment, working in physically demanding conditions, responding to emergencies at all hours, had taken a serious and cumulative toll on his back. By the time he retired at 62, his back pain was a constant daily companion that he had simply accepted as the inevitable price of his career. He had moderate degenerative disc changes at multiple levels confirmed on MRI. His mornings were the worst, stiff, aching, and slow to get moving. He could not stand for long periods without increasing pain. He had stopped gardening, something he had always loved, because an hour bent over his garden beds left him barely able to straighten up for the rest of the day. He managed his pain with over-the-counter anti-inflammatories that he took almost daily, something his primary care physician had cautioned him about repeatedly given the long-term risks to his stomach and kidneys. Ramon's wife, Maria, had been reading extensively about natural approaches to back pain and connective tissue repair. She came across multiple studies on collagen supplementation for spinal health and was struck by how directly the research seemed to apply to her husband's situation: degenerative disc changes, ligament laxity, facet joint arthritis, all collagen-depleted tissue problems. She ordered a high-quality combined type 1 and type 2 collagen capsule supplement and presented it to Ramon with the research she had found. Ramon was a practical, evidence-oriented man. He liked facts and he liked results. He read through the studies Maria had printed out and agreed to give it a genuine 3-month trial. He committed to taking his collagen capsules every morning on an empty stomach with 1,000 milligrams of vitamin C every single day without exception. The first 3 weeks produced no noticeable change, and Ramon told Maria he was not sure it was working. She reminded him that tissue repair takes time and encouraged him to stay consistent. At the end of week 4, he mentioned, almost casually, that he had gotten out of bed 2 mornings that week without his usual stiffness ritual of sitting on the edge of the bed for 10 minutes before being able to stand up properly. Small, but real. By week 7, the change was more pronounced. His morning stiffness, which had been lasting between 45 minutes and an hour every single day for years, was now resolving in about 15 to 20 minutes. He was taking his anti-inflammatory medication significantly less frequently. By week 10, Ramon was back in his garden, not for hours, but for 45-minute sessions that left him tired but not in the kind of pain that had driven him out of his garden in the first place. And at the end of his 3-month trial, Ramon sat down with Maria and told her something that made her emotional. He said, "This is the first time in 4 years that I feel like my back is actually getting better instead of just getting worse." He said it felt like something inside his back was slowly filling back in. He could not explain it better than that, but he knew something was different, something structural, something real. Ramon has now been taking his collagen capsule protocol for 14 months. His morning stiffness has reduced by what he estimates is 70 to 75% from his worst point. He gardens for up to 2 hours on good days. He has reduced his over-the-counter anti-inflammatory use by approximately 80%, and he has become something of an unofficial advocate for collagen supplementation among his retired firefighter friends, several of whom have started the same protocol after hearing his results and are reporting their own meaningful improvements in back pain and mobility. So here is your complete collagen capsule protocol for back pain relief after 60. Exactly as the research supports it. Every single morning on an empty stomach, take your combined type 1 and type 2 hydrolyzed collagen capsules at a total dose of 5,000 to 10,000 milligrams. At the same time, take 500 to 1,000 milligrams of buffered vitamin C. Drink a full glass of water with your capsules and wait at least 30 minutes before eating breakfast to maximize absorption. Do this every single day without exception. Consistency is everything with collagen supplementation because the structural repair effects build cumulatively over weeks and months of sustained nutritional support. To maximize the results of your collagen protocol even further, pair it with these additional daily habits. Stay consistently well hydrated. Your spinal discs are highly water dependent, and adequate hydration is essential for maintaining disc height and flexibility alongside your collagen supplementation. Avoid prolonged sitting without movement breaks. Get up and move gently for 5 minutes every 30 to 45 minutes to maintain circulation to your spinal tissues and ensure your collagen supplements are being efficiently delivered to the tissues that need them most. Add magnesium glycinate to your evening routine. Magnesium is essential for muscle relaxation, reduces the muscle tension and spasming that amplifies back pain, and supports the deep restorative sleep that is when most of your spinal tissue repair actually occurs. Eat adequate protein at every meal. Your collagen-producing cells need a full complement of amino acids to do their repair work, and protein-deficient diets significantly impair collagen synthesis regardless of how much collagen you supplement with. And consider adding a daily walk of 20 to 30 minutes. Gentle, consistent movement is one of the most powerful ways to stimulate circulation to your spinal tissues and enhance the delivery of the collagen peptides your body is absorbing. Give your collagen capsule protocol a genuine minimum of 8 to 12 weeks before evaluating your results. Structural tissue repair is not an overnight process, and the most significant and lasting improvements in back pain from collagen supplementation build progressively over this time frame. Most people begin noticing meaningful changes between weeks 4 and 8, just as Ramon did, with continued and compounding improvement developing over the months that follow. Be patient, be consistent, and pay close daily attention to your morning stiffness duration, your pain levels throughout the day, and your functional capacity. How long you can stand, walk, garden, or do the activities you love before pain becomes limiting. These are the real measures of whether your collagen protocol is working. And for the vast majority of people over 60 with collagen-driven back pain, the trajectory of these measures with consistent collagen supplementation is unmistakably and encouragingly positive. The bottom line is this: chronic back pain after 60 is not a life sentence. And it is not a problem that requires more medications, more injections, or more invasive interventions as the only answers. When the root cause is the collagen deficit that is universal in aging spinal tissues, and for most people over 60 with chronic back pain, it is a significant contributing factor, then collagen capsules taken correctly, consistently, and in combination with vitamin C represent one of the most scientifically sound, safest, and genuinely effective nutritional interventions available. Ramon found this at 66. His back is not perfect, but it is better than it has been in years, and it is continuing to improve. The same is possible for you. Start tomorrow morning, 1 capsule every single day. Give your spine the building material it has been missing. Now, before you go, drop a comment below right now and tell me your age and the city you are watching from. And tell me, have you ever tried collagen for your back pain? Are you going to start this protocol? I read every single comment personally, and your experience matters deeply to everyone in this community. And if this video gave you hope, a plan, and a real reason to believe your back can feel better, please share it right now with someone you love who is struggling with chronic back pain. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Take care of your back, because when your back feels strong, your whole life opens back up. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. The patient story featuring Ramon is for illustrative purposes only. Individual results will always vary. Collagen supplements may interact with certain medications and may not be suitable for individuals with specific allergies or dietary restrictions. Always consult with a qualified licensed healthcare professional before starting any new supplement protocol, especially if you are over 60 and managing existing health conditions or taking prescription medications. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.